What is panhypopituitarism? It is the decreased secretion of all the hormones of anterior pituitary. The pituitary gland is located at the base of the brain, just below the hypothalamus. It sits within a small, bony cavity called the sella turcica, anterior pituitary or adenohypophysis. Anterior pituitary is also known as the master gland, because it regulates many other endocrine glands through its hormones. Anterior pituitary consists of three parts. 1. Pars distalis. It is responsible for producing and secreting several hormones such as GH, prolactin, ACTH, TSH, FSH, LH. 2. Pars tuberalis. It primarily serves a structural role. 3. Pars intermedia. In humans, it is often considered to be rudimentary. 6 hormones are secreted by the anterior pituitary. 1. Growth hormone, GH, or somatotropic hormone, ST. 2. Thyroid-stimulating hormone, TSH, or thiotropic hormone. 3. Adrenocorticotropic hormone, ACTH. 4. Follicle-stimulating hormone, FSH. 5. Luteinizing hormone, LH, in females or interstitial cell-stimulating hormone, ICSH, in males. 6. Prolactin. Recently, the hormone lipotropin is found to be secreted by anterior pituitary. There are 3 main causes of panhypopituitarism in adults. 1. Craniopharyngiomas. Pituitary tumors that develop from the cells of Rathke's pouch, which is an embryological structure that forms the anterior pituitary. 2. Chromophobe tumors. A benign tumor of the pituitary gland composed of cells that do not stain with standard histological dyes, that is, the chromophobe cells. These tumors often lead to hormonal imbalances by compressing nearby structures. 3. Thrombosis of pituitary blood vessels, which usually occurs due to postpartum shock as generalized effects of panhypopituitarism. 1. Hypothyroidism. Due to a deficiency in thyroid-stimulating hormone, TSH, without sufficient TSH, the thyroid gland is not adequately stimulated to produce thyroid hormones, leading to hypothyroidism. 2. Depressed production of glucocorticoids by the adrenal glands. Due to a deficiency in adrenocorticotropic hormone, ACTH, without sufficient ACTH, the adrenal cortex is not adequately stimulated to produce cortisol, leading to adrenal insufficiency and a deficiency in glucocorticoids. 3. Suppressed secretion of the gonadotropic hormones, that is LH and FSH. Without sufficient LH and FSH, the reproductive organs are not adequately stimulated, leading to a reduction in the production of sex hormones, estrogen and progesterone in females, and testosterone in males, and impaired reproductive function. This can result in symptoms such as menstrual irregularities or amenorrhea, absence of menstruation in females, reduced libido, infertility, and other reproductive issues in both sexes. Generalized picture of panhypopituitarism. 1. Lethargic person from lack of thyroid hormones, because thyroid hormones control the body's metabolism. 2. Who is gaining weight because of lack of fat mobilization by growth, adrenocorticotropic, adrenocortical, and thyroid hormones. 3. Has lost all sexual functions due to lack of gonadotropic hormones. Treatment. Administration of adrenocortical and thyroid hormones. Sexual functions can't be recovered because panhypopituitarism often results in secondary gonadal dysfunction. Even if hormones like LH and FSH are administered, the gonads may not respond adequately due to long-term suppression or atrophy caused by the lack of pituitary stimulation over time. Causes of panhypopituitarism in childhood. Congenital, which includes genetic mutations affecting pituitary gland. Acquired, which include trauma, tumors, infections, radiation therapy, or autoimmune disorder. Most cases of dwarfism are due to panhypopituitarism in childhood. All body parts develop in appropriate proportion, but rate of development is slow. Dwarfs due to panhypopituitarism does not pass through puberty due to lack of sex hormones. Dwarfs who have pure growth hormone deficiency can be cured with human growth hormone, HGH, made by Escherichia coli. 45-year-old male presents with a 6-month history of progressive fatigue, muscle weakness, unintentional weight gain, decreased libido, and erectile dysfunction. He also reports cold intolerance, constipation, frequent headaches, and dry skin. Physical examination reveals pallor, dry, cool skin, and slightly decreased reflexes. Laboratory tests show low levels of TSH-free T4, ACTH, cortisol, LH, FSH, testosterone, and prolactin. MRI of the pituitary gland reveals an empty cell ataxia. The diagnosis for this scenario is panhypopituitarism. Cold intolerance. Thyroid hormones are critical for regulating metabolism and body temperature. A deficiency results in decreased metabolic rate and a reduced ability to generate body heat, leading to cold intolerance. Constipation. Hyperthyroidism slows down metabolic processes, including gastrointestinal motility, causing constipation. Cool, dry skin. Hyperthyroidism leads to reduced sweat and oil production, which can cause the skin to become dry and cool to the touch. Headaches. Imbalances or deficiencies in various hormones can also contribute to headaches due to changes in fluid balance, blood pressure, and stress response. Pallor. Hyperthyroidism and other hormonal deficiencies can contribute to anemia, which can cause pallor. Reduced reflexes. Hyperthyroidism can slow nerve conduction and muscle function, resulting in decreased reflexes. So verily with the hardship there is relief. Reference Al-Quran. Do subscribe, like, share and comment. Thanks a lot.